practice, other industries, engaging with consumers, the experience, and brought that over. So with that, I'm going to turn it over to Angela. Thank you.
Thank you for inviting me to speak to such a great group of digital experts. It's an honor to be part of this conversation, and I look forward to more live interaction over time. So today, I'll talk about the lessons we can derive from other industries and apply to the way we accelerate the evolution of healthcare. We've seen some of these lessons applied at forward-thinking systems who are changing the way they think about the capabilities required to achieve the outcomes that we all want for our patients and communities. Foundationally, the world is changing more rapidly than ever before, and this change is being felt in every industry. So first, let's talk about some cross-industry trends and how they apply to healthcare. So first, the strength of your ecosystem is a differentiating factor. Long gone are the days when all the competitive ideas come from within a company's four walls. And I think most industries have realized that differentiation doesn't come from a big vendor's roadmap either. Across industries, companies that are finding ways to engage with startups and universities and other research institutions and inventors and tinkerers and even some research groups inside of big vendors who are willing to engage differently are able to flex and be very intentional about the way they define and deliver solutions that will set them apart from their competitors. They'll simply have more options. You know the old argument, buy versus build? A lot of the time the right answer is somewhere in the middle with co-creation, adoption of components that fit into the current state but can evolve as the business evolves, and so on. So this past year, as an example, we even partnered with a design and engineering company that builds Formula One and NASCAR race cars. They had super smart people with heavy engineering skills, as you'd expect, and it was a pleasure to work with them. Co-opetition is another great method that was introduced by the thought leaders in reality TV. But sometimes working with a competitor to achieve something that will elevate the service that you both offer to the community is the best and fastest way to advance. We certainly see it in healthcare, this year perhaps more than ever before as we battle a global pandemic. So the lesson here is to make sure you're never making another buy versus build decision, and that instead you are building a diverse ecosystem of contributors of all types who will allow you and your teams to grow and differentiate over time. Another trend that we see across many industries is the evolution of consumer appetites. So our patients and the communities that we serve are all consumers of our products and services. They're being trained by other industries in many different methods of engagement, and their expectations of service levels are higher now than ever before. It's a very good thing for healthcare. So let's talk about why. First, our patients expect to be able to engage us across multiple channels. So if they can order a pizza by tweet or by Slack channel, then we should make it just as easy to schedule an appointment or pay a bill. The easier we make it for our patients to manage their health through engagement with the healthcare community, the more likely our patients are to stay healthy and avoid major health events through preventative means. And this not only requires contemporary looking design and consumer grade tools that we put in the hands of our patients, but also investments into the back-end architectures that enable transactional integrity between channels. So this notion of transactional integrity is pretty important. So let's talk about what I mean by that. There's some great examples in banking and retail and other industries. So in banking, if you go online to transfer money from one account to another, and while you're in the middle of that transaction, imagine your internet connectivity drops, you expect to be able to call or text a helpline or walk into a bank branch and have a representative be able to see the exact status of your transaction. You expect to be able to complete or continue your transaction in a different channel from where you initiated the transaction. In retail, same thing. If you use an app to order a big screen TV, you expect to have the option to pick up that TV in a nearby store. The transaction has integrity across all channels. In healthcare, some of the integrity is enabled by the use of a single EHR, right? Most healthcare systems of any size have done this, particularly in terms of clinical engagements. But in the case where I start a video visit with my physician, and then I need to finish the exam in a clinic, or heaven forbid in the emergency department, making that transition seamless requires us to have another layer in place. So we need a place to capture non-clinical experiential information and allow that engagement to be carried over from channel to channel. We want to avoid the feeling of disjointedness that a patient could feel going from one location, virtual or otherwise, to another. Now, the optimal solution sets are going to be different for everybody. But in the case where a patient moves from a virtual visit into a clinic, you might need a strong CRM capability to track non-clinical patient communication outside of the EHR. You'd probably want some geofencing based auto check-in at the clinic. You'd probably have virtual waiting rooms with direct to exam room wayfinding and so on. When the clinician enters the exam room to see the patient after verifying the identity, they can pick right back up with the appropriate context, and of course still have access to the clinical information and vitals that may have been collected remotely through advanced sensor tech that and loaded into the EHR. Healthcare organizations have focused so much on perfecting their collection and protection of clinical data, and rightly so, that some have maybe forgotten to also collect and act upon that customer experience data that informs every engagement the patient has with us. And so I think there's a lot to be learned cross industry in the consumer engagement space. Another trend that I think it's worth talking about today is the traditional constraints to competition that continue to loosen. So other industries have been feeling the crunch of new entrants skimming off the new lucrative business for decades now. We saw this in e-commerce versus physical retail stores, right? Virtual banking versus local banking in a branch. Uber and Lyft versus taxis, Airbnb versus hotels and hospitality, small, well-funded research labs versus big pharma, and so on and on and on. Successful organizations, regardless of industry, are able to flex, and they can respond to the emergence of unconventional competitors. I mentioned pizza earlier. Maybe I'm just hungry, but Domino's is a great example of a company that responded to the expansion of food delivery options by making their pizza more available than other restaurants could do through Uber Eats or DoorDash. You can, in fact, tweet or text or post an order on a Slack channel. You can drop a pin where you want the pizza delivered. And sometimes even a robot or an autonomous vehicle of some sort could get it to you while you're standing in the middle of a pedestrian zone. It's a great example of a company expanding ahead of others who started to encroach upon their traditional point of differentiation, which was, the 30-minute delivery. So what is the healthcare equivalent? One area is digital health. I think certainly during the COVID crisis, most systems have adopted a digital health capability, and rightly so. Past expansion had been limited not by the technology capabilities, but by regulatory restrictions, business decisions. There were licensing restrictions, which seem to be loosened now in the COVID crisis. Their reimbursement philosophies are changing during this crisis. It's all great for our patients, and we should continue to encourage these changes. But if we're not keeping up with and in creating differentiating services in this space, we're at risk of losing this part of our business to others in and outside of our geography and in and outside our core business. Another business threat that's fairly immediate is the phenomenon that we see of small footprint specialty outpatient centers who are skimming off lucrative elective procedures and leaving large healthcare systems just to running EDs. The loss of specialty services and elective procedures will hit traditional healthcare hard. The fragmentation of these services to the patient are going to create a further disjointed experience for them, and it's going to result in less healthy communities. So the lesson, I guess, here is that others will continue to come after your market. Don't think it's all tied up because of past barriers to entry. Companies that are bigger, have deep pockets, and can literally buy your customers and your markets will be coming. So what do? You have to be nimble, of course, fast. You have to offer new services, new products, outrun well-funded big guys from other industries, stay ahead with differentiating solutions. And for goodness sakes, do not listen to anyone who tells you the right thing to do at these times is to go back to basics. So the last trend I'll talk to you about today is something that we've seen in many other industries, and it's worth discussing in terms of healthcare. M&A activity is rampant. There are lots of industries engaging in M&A, and I want to talk a little bit about this phenomenon because I think it's important to understand what it means when a company chooses to outrun its losses through an acquisition. So the amount of M&A we see in other industries that are also under attack, like retail, is really extraordinary. Taking retail as an example, traditional brick and mortar retailers have been upended by online retailers for decades now. When two traditional retail companies who are losing ground join forces, they combine their revenues and reduce overall operating expenses by eliminating, redundant functions. So the day the books close, they look like they're doing pretty well. The CEOs get a big bonus and off they go. But then the next year, or maybe 2 years later, because they have not changed their strategy or their underlying approach to the way they make money, they're losing money again because their industry's under attack until the next acquisition. And then they outrun the loss once again. The retailers continue to outrun their losses through these sorts of serial acquisitions. Now, the traditional retailers who have held their own and done well as their industry comes under attack, or I should say evolves significantly, are not only engaging in this sort of M&A activity, but they're also buying up adjacent businesses. And they're partnering with others in completely different businesses. So take, for example, the big retailers that we've all seen who now offer healthcare or optometry or Starbucks coffee stands inside of their physical footprint. It's not because these partnerships make them a lot of money directly, but because they bring in foot traffic. They create a destination feeling for their consumers. It's a brilliant expansion into adjacent spaces for them. So in healthcare, it's easy to imagine the different sorts of acquisitions and partnerships that we might be exploring along these lines. You see a lot of healthcare companies buying up software companies. That makes a lot of sense for a lot of reasons. It's important for our teams to be prepared for unexpected acquisitions and unconventional acquisitions. Earlier this year, before we all went on lockdown, my last extended staff meeting, so my directs and then their directs, we ended up with, I think, about 75 or maybe 100 people in the room. And I asked them to imagine, they were broken out into groups, and I asked them to imagine that we were requiring a major airline. That, just to be clear, we are not acquiring a major airline, but that exercise allowed me and my senior staff to see how my very smart team thinks about these sorts of things. What would it take to acquire that airline? How would we manage the integration? What are the sorts of opportunities that may now exist as a result of our partnership and our joint ownership? So, and by the way, how prepared are we for such an integration? I encourage you to try something similar with your teams. It's always good to be prepared for the unexpected. So time's running short. I'm going to leave my comments there. Thanks for the chance to reflect upon some of these cross-industry lessons that we've recognized here at Novant Health. I look forward to hearing from all of you and seeing your continued innovations and successes. Please enjoy the rest of the conclave.